Hi there, I'm John-Manuel Andriote, and I'm going to talk to you about resilience and about telling your story as a story of resilience during the COVID-19 pandemic. Resilience is a pretty popular term these days. We hear talk about New Jersey strong after tropical storm, superstorm Sandy struck, Boston strong after the Boston massacre, Houston strong after the hurricane that devastated Houston. And the theme in all of that strength is resilience, that we took a big hit, but we're still going to go on because we have survived other big hits in our lives, in our history, and we know, we're pretty confident that we'll get through this one as well. I'm actually talking to you at the end of a long moving day of all things to be doing during the COVID-19 pandemic and sheltering in place and so forth here in Connecticut. But today, interestingly, when I was at the U-Haul place to pick up my truck this morning, it was open. I guess it's an essential business. One of the men behind the counter said to me, gee, it's really too bad to be doing this during what's going on. And my response to him was, life goes on. And indeed it does. Whether we are sheltering in place or, I guess, sheltering in place, that's sort of the prevailing norm and expectation, if not mandated by our elected officials. But pretty much all of us are in the same boat in a very real way. And it's pretty amazing to read stories from around the world of how other countries are experiencing the pandemic. But pretty much we're all doing the same thing, staying indoors, waiting for the threat to pass. It's very scary. It's very traumatic to read in the news constant stories about sickness and death and illness and sorrow and grief. And yet, I look outside. Today's March 31st. I look outside and I see spring unfolding here in Connecticut, and it's beautiful. And the forsythia are blooming. I saw my first robin the other day. And for me, spring is not just a symbol of renewal, of the earth renewing itself, but it's a symbol of hope. It's a symbol of life prevailing over death. Think about that. Think about that going back to the myths, the Greek myths, when Persephone was held captive by Hades for the winter, but in the spring he released her. And that explained the rebirth of the earth in all its beauty, in all its lush fecundity and fertility. So spring is a symbol of hope, and we need those symbols. We need those things to focus our mind on eternal things. And I'm not talking religious eternal, but I'm talking about the cycles of nature, for example, the seasons changing, the things that are more predictable in life than so many things seem right now. So that's one of the ways that I am maintaining my resilience, is reminding myself that I am resilient, that I will get through this, that I will take the precautions recommended by public health experts, wash my hands frequently. I'm pretty much staying indoors like everyone else. When I do go out, I try my best to practice social distancing. I'm not covering my face because the latest CDC recommendations were that we don't do that. So I'm not going to do that until the CDC suggests otherwise. Basically, I'm looking at this experience as a far vaster, bigger, global experience of what I and so many gay men my age, I'm 61, so many of us lived through in the early years of the 1980s when AIDS was first reported among gay men. It was a very terrifying time if you were a gay man, if you were living in a major city, as I was. I was living in Boston in 1981 when I first heard about AIDS. Then I moved to Chicago to go to journalism school, master's program. And from there I moved to Washington, D.C., where I lived for the next 22 years. And that's where I really focused my reporting career, documenting and chronicling the AIDS epidemic. So I've lived through, the dark years of that deadly viral pandemic that wasn't affecting everyone as extensively as it was affecting people in my community, other gay men, people of color. And, I saw firsthand how communities around the country pulled together to take care of one another, to create services, to lobby the government, to create prevention education programs, to take care of the sick, to make sure others didn't become infected. And I saw this tremendous outpouring of love and community, and it was really amazing. And being part of the effort to address the pandemic, if you were a gay man back then, part of the effort of being involved was the thing that kept us resilient, that helped us to stay hopeful and optimistic, and that gave us a sense of meaning and purpose as we were all addressing a threat to our community and to ourselves. But even back then, I was talking with a friend of mine today who's my age, a little older, but we lived through the same thing in DC, and he agreed with me that what we did back then was we stayed informed, we practiced the precautions that were advised by public health experts. In the case of HIV, of course, that meant sexual practices that would protect us and our partners, and we went on with our lives. And I think that's a real key and something very relevant for today. That a friend of mine yesterday who didn't have the experience that I did, who was actually a straight white man here in Norwich, Connecticut, didn't live in a major city, wasn't a gay man. He texted me and he said, I hope we live through this. And I responded to him and said, I can't speak for you, but I intend to live through this. And I reminded him of my experience as a gay man who had lived through the dark years, the really terrifying years of the AIDS pandemic, when there was no treatment, when testing positive meant that you were very likely going to get sick and die. It was really scary. It was really scary. And if you tested positive for HIV, there's really no treatment. They could treat the opportunistic infections that would kind of really harm your body as your immune system was slowly destroyed by the virus. But the bottom line is there was no treatment for HIV itself. So it's very scary. But again, my friend agreed with me today that we did what we had to do. We took precautions, we stayed informed, we got on with our lives. And I hear my Bose thing talking to me, saying it's connected. Anyway, an important theme that's coming through what I'm trying to say to you is that reminding ourselves that we have already lived through difficult, challenging experiences, traumas in our lives, most of us, pretty much every one of us, and that how we are able to live and move forward in light of those experiences has so much to do with what we tell ourselves those things mean, what they mean. Does having HIV mean someone is immoral, that they are unclean? Well, the stigma that still surrounds HIV to this day would have us believe that. But I don't believe that, and I've never once believed that, which is a reason I dedicated my reporting career to writing about it. But more importantly, for me, as a person living with HIV, past 14 years, I've had to learn a lot about what I'm made of and what I value, what gives me meaning and purpose in my life. I've had to frame the story of my experience of having reported on the HIV-AIDS pandemic for 20 years as an HIV negative gay man, as a negative gay reporter in Washington, D.C. And then suddenly to have my doctor call me after my annual physical checkup and the blood work for it and tell me, I have bad news on the HIV test. Well, that was the before and after moment in my life, before my diagnosis and after my diagnosis. But I knew, because I had been reporting and telling so many other people's stories for 20 years by that point. I had known many heroic people, heroic gay men who in the earliest, darkest years of AIDS, in 1983, said, "We are people with AIDS. We're not AIDS victims." They insisted on a voice in every decision about them, about their care and treatment and the services that were being created in the community, in the gay community, to take care of them. They insisted on being active in their own care, not just passive recipients of paternalistic, medical care, but they demanded to have a role in every decision made about them. Okay, so I looked back when I had my diagnosis. I looked back and I thought, geez, I've got some awesome role models who really showed, when it counted, what it means to be resilient and what it means to be an openly gay, proud gay man, not ashamed of yourself and not about to be cowed into shame and silence by the stigma that society attached to HIV. So, drawing on my pretty deep and extensive knowledge of AIDS history, I thought, those are my role models. Those are the people after whom I want to model my story. I want to tell my story as a story of resilience, of courage and strength and creativity and resourcefulness. It took me a number of years to really get to the point of understanding what that was about, what I had learned about myself through these experiences, about resilience, about how I had been able to frame the stories of my life's traumatic experiences, my losses, friends, and my father. Last fall, my mom died at 84 years old. That's one of my latest traumas that is being sort of having salt in the wounds every day, hearing and reading about older folks who are being so hard hit by the coronavirus. It's just heartbreaking. And so I think to myself, I've been through all these difficult things, but I'm still here. As Shirley MacLaine and others sang it so well, I'm still here. I've been through all this, and I'm still here, and I still feel optimistic and hopeful. And I want to believe that, once again, in this pandemic, taking the necessary precautions will get us through, but getting through intact, getting through emotionally intact, psychologically intact, has a lot to do with what we tell ourselves about what this whole extraordinary experience means, what it means. And I think that a resilient way to think about it, and this is how I think about it, and I think that I'm resilient. I wrote about it in my book, Stonewall Strong. I sort of gleaned lessons on resilience from my life and from the lives and experiences and work of about 100 other people whom I interviewed for the book, Stonewall Strong. And just a little aside, the image of the stone wall, it wasn't just the gay bar in New York that gave the name Stonewall, but the political movement. But for me as a New Englander, as a Connecticut Yankee, stone walls have great significance because they're all around us here in New England. And a few years ago, I did an article for Earth magazine. It was a cover story about New England stone walls, the science, geology, and poetry of them. And I found in learning about the stone walls and the massive amount of labor that it took to build them at a time when there weren't all these great power tools and machines that we have today, I really came to see them as images of incredible resilience, as symbolizing, the archetypal Yankee grit, basically. I mean, that's what it is, resilience against the harsh winters, building the stone walls after the stones were heaved up out of the earth each spring, and just carrying on, against tremendous odds, settling the interior of this country. So I looked at the stone walls and I sort of adopted them as my image of resilience. So Stonewall Strong is my way of thinking about resilience. And it's all about what went into bringing us to this moment. How did we get here? What did we tell ourselves about our difficult experiences? And how did we get through them? And reminding ourselves that we have gotten through them, that we're still here, okay? And that we need to keep telling ourselves that, and telling ourselves we'll get through, because that's what we have done, and that's what we know ourselves able to do. So telling ourselves telling our story in this COVID-19 pandemic as a story of resilience is really about framing it in a way that lets you go on day to day and get through this. And you can and you will get through this. And a big part of it, again, is what you tell yourself. We're not being uniquely punished, singled out. The whole world is in this together. It's an extraordinary experience just in that sense, that everyone is experiencing this at the same time. But, as with other really terrible traumatic experiences, getting through it and beyond it will have big implications for us, how we think of ourselves, how we relate to other people. Will social distancing become more norm? Will people start to cover our faces in public? All sorts of questions that will remain to be answered after it's all over. But now we need to get through it. And I'm just suggesting that based on my experience, and I've described some of it here, that you'll think about your own story and your own life and the other things that have challenged you and what you had to do and what you had to tell yourself to be able to get through it and look at it as a lesson in life, so that you could move on. And as I said earlier, talking about the guy at the U-Haul shop, life still goes on. And resilience is so much a matter of what we focus on and what we tell ourselves it means. So, focus on the beauty of the unfolding spring. Focus on the faces of your loved ones and your loved ones in photographs, whether they're present or departed. But life goes on, and it will go on, and we will get through this because we're resilient. Okay. Stay well.